We got some people waiting. Sorry for a little delay opening the doors, but welcome to Fear Factor. We're excited that you're here today. Oh, look at that. 135, Keith, 140. I love it when I see them all coming. Yeah, I believe all of our meetings should allow for the closed caption. So if you're in here, we might have a few hoarse speakers. If you need to turn on the closed caption, it might be helpful. We're going to give a couple minutes for all of you guys to get in, but welcome, welcome, welcome. I'm going to shut my door. I got talkers in my house. All right.
We're going on 175.
Keith, I haven't done a webinar in so long. It's like,
I know.
It's so weird when I can't see the people that we're talking to. While everybody's coming in, I'm just going to start going over a little bit of the housekeeping. Welcome to Fear Factor. This is actually, I think, the first one that we've done maybe in 2023. We've had a lot going on, and we finally got our stuff together thanks to our wonderful panel that's here. But if you are here, if you registered in the OACB Member Connect, then we are, you will be able to collect your CPDUs in the next probably 2 days, probably by Friday afternoon. They should be available. We'll just have to do a check-in. If you are coming in from, and you don't need CPDUs and you just got a link, that's fine. We're just really glad you're here. We're going to be doing a poll in a little while to find out who we have in the room. As far as just housekeeping, please know that if you need closed captioning or you prefer that, you can enable that. I believe in the bottom, about halfway, 3/4 of the way over, it says show captions. You can opt to do that yourself. If you have a question for the group, you can put that in the Q&A, which is also on the bottom, just to the right of the middle where it says Q&A. Before you put a question in Q&A, double check and see if somebody else has already asked the question, and you can instead just upvote that by giving it a thumbs up if that's the same question you would have had. That will let us make sure that we're answering questions that are the most relevant to the most people. If we ask for feedback, or you want to say hi to somebody, or you just want to put something like, hey, Lisa, you're beautiful, in the chat box, you can do that. You can put anything you want in the chat box. It'll be amazing. But I'm going to tell you that I don't pay complete 100% attention because there's 200 plus people in here and it's hard to follow the chat box. So let's see, we have a lot of panelists today. We're up to 200 people. We're getting Q&A questions. Chat not working, only Q&A. All right, well, that's good. Let me fix that for you all.
I just got a text from Star saying she couldn't put anything in chat. So
because people are trying to say how beautiful I am, you know.
I know.
And here I didn't even give them that opportunity. Hold on, I'm going to fix this for you. Show chat previews, host and panelists. There we go. Okay, so send chats to everyone. Save chat. Okay, here you go. Attendees can chat with everyone. There you go. Try again and you tell me how beautiful I am, and I think you'll be able to do it. There.
That was your motivation, your incentive.
Oh, look at all those people. Oh, you're all so beautiful. Thank you. All right, I'll get rid of all that stuff in the Q&A then. Arthur says, so beautiful, he's stunned. Okay, well, listen, we got 212 people. It is 1:04. Yay. We most likely, knowing this group, will go right until 2:30, but we will be stopping every once in a while for questions. Myself and Ann Tapia will be looking at the questions and trying to help out. And of course, our amazing panelists are back there in the background, looking at your questions constantly and deciding what to answer and what we should talk about. So on that note, Keith, I'm gonna let you kick it off.
All right, thanks for showing up. I'm always excited about these things, and I also am excited because I'm going to get to introduce somebody that's going to take over for me my little MC role, and she'll do a much better job of it. So again, welcome, and thanks to the panelists. This is going to be a great day. But I wanted to introduce, and I guess you could just introduce yourself and then kind of step in, and I'll step out.
Sounds good. Hi, everyone.
right.
My name is Ann Tapia, and I am the Community Life Engagement Project Manager in the Southwest Ohio region. So I'm thrilled to be here today. I know I have big shoes to fill. Keith has been your entertainment host in the background, and I will do my best to fulfill that role with you all. But I'm excited to be here. We're going to kick off by just walking through a little bit of context of the background behind Fear Factor. And we'll do some introductions of who all is on the panel and going to be sharing out today. Then we'll dive into our topic about Medicaid buy-in for the bulk of the time, 1:15 to 2:15, and then wrap up with some Q&A and next steps and some additional polls. So we're going to start off with a poll. We'd like to just know who's here today. So Lisa is launching.
I'm going to launch that poll. All right, here we go. So we've got, just let us know who you are. Sorry, I lump everybody that is not an SSA into other county board staff. I know you're all amazing, no matter what you do. I love y'all. But we got family members, hopefully. I see a few, some self-advocates or persons with lived experience. If there's any providers on the call, we'd love to know about that. OOD staff, DODD staff, and of course, there's always a group that I don't really know who you are, but I'm glad you're there. If you are other, I would love to know in the chat box. You can certainly put that in there. So, good. You guys are fast. I've already got 85% answering the poll. I'll give it just another couple seconds. We'll make sure we got as many people that can answer as possible. And, well, you're right. Yes. So yeah, for people that are attending, everybody is muted and we cannot see you. We just talk like we can see you. So, oh, good. SSA supervisor, guardian with APSI. Thanks for joining. Transition and adult living specialist. Great. Okay. I'm going to go ahead and end the poll. We have almost 90% in, and I'll share it back out to all of you so you can see. All right. So we've got 64% of the folks here. Hey, look, I got a picture in there. Who is here today? SSAs are comprising 64%. Other county board staff is another 25%. We've got 7 family members on the call. Thanks for coming. We've got 1% or 2 people that are self-advocates, people with lived experience. We've got 3 providers. We've got some staff from Opportunities for Ohioans with Disabilities, staff from the Department of DD, and then we've got some others as we talked about it. So thanks for everybody that is on right now. All right.
Chat, it looks like there are a few people who responded, a Medicaid manager and a Medicaid services specialist. So we've got some folks who maybe can chime in with their experiences in the chat as we go through too.
Awesome.
Great. Okay, so Fear Factor. The idea behind Fear Factor is that these sessions will break down facts, evaluate the topic, think about the action steps, and importantly, get us to the results. So our hope is that you walk away feeling armed with the knowledge you need to move forward. So
go ahead. I told Ann that part of her being the new person, she has to share her fear. So those of you who have been here before know that Keith and I, we always talk about fear because this topic is so scary. It's scary for me personally. It's scary. As an SSA working in Lucas County back in the day, as soon as I started talking about benefits and Medicaid buy-in and working while getting benefits, everybody's, face just kind of like blanked out. So, we know it's scary. That's why we came up with this. And we know that the only way to get through that is to have those facts so that we can make the decisions. So Ann, what's your fear that, I don't know, maybe are you fearful of this topic or do you have another fear that you want to share?
I mean, this topic is deeply confusing and it certainly frightens me if people ask me questions because I'm like, I don't know, but we'll gladly connect you to someone who does. But I wanted to share another fear. My fear is those who are in isolation. That just worries me so much. I think we are in a society where there's a lot of reasons why we find ourselves feeling isolated and alone. And I hate that. I want people to feel connected to community and be finding strong bonds with each other.
That's a great one. And thanks for sharing that. That's definitely one of the reasons why a lot of family members and SSAs and people in our field want people working, right? So that they can have that kind of networking and connection outside of their immediate family and providers. So thanks for sharing. All right. Next slide. So yeah, so that this is definitely, sorry, providing access to the experts. You know, we have some amazing experts on here, and we have, and none of us are going to be the experts that some of the folks on this call are. I don't know, Ann, is this where we introduce people? I don't even know.
Not yet. We're still
Okay.
giving context behind background. The idea though is that in all of these, you're getting the resources and the connections to the people who, when you're like me, faced with somebody asking a question, you can say, hold on, here are the people who know, and reach out to them. We will introduce them in just a minute, but we wanted to remind you that this is the 7th of these Fear Factor episodes. There were 6 that have been recorded previously. You can check those out, as well as some of the resources that have been offered in those previous sessions. You can obviously can't click on the link right now, but you can go to the website and find this. We can share that out in the chat to take a look at some of those sessions that you may have missed, covering Social Security income, Social Security disability, Medicaid, Ticket to Work, and of course today's Medicaid buy-in. In each of those, we go through several of the fears and the benefits of work. And then there are some additional polls at the end of episode 4. And oh, this is probably a previous one. Then buy-in is what is today's session. So here's the list of all of these sessions that you can find, and we can drop this link in the chat so you can find where to watch those on demand.
Yeah,
One more, another poll.
We got another poll because Lisa loves polls. It's all good. Let's see if I go launch this one about Medicaid buy-in. So how much do you know about Medicaid buy-in for workers with disabilities? And you just can pick one choice. So you've never heard of it, you've heard of it, but you don't really know anything about it. You consider yourself really knowledgeable about it, or you think, hey, I could probably be your guest presenter next time because I know as much as these people on here. So, which if you know more than me, you're not really that much of an expert, but if you know more than Jeannie and Dorinda and Nate and all them and Paula, then you're doing great. All right. So I always like to see a mix of answers. And I always love that we've got a few people that say that they know as much as the presenters too. You be strong and confident. That is true. There are a lot of experts in our world. We just got to find y'all. So I'm going to give it another second so we can get up 80%. A couple more of you answer those questions. All right. And we are there. I'm going to go ahead and end the poll and share the results back out for you so you know who's in the crowd with you. So obviously we've got some folks that are very similar to me, which is like, I've never heard of it, or I know nothing. I don't even know what it stands for. Right. And then of course 70% of the people say they've heard of it, but don't really know much about it. 20% are saying that they consider themselves fairly knowledgeable about it. And then we have 1% or 2 people that feel like they could potentially join our presenter panel, which if you're not a presenter right now and I don't know you, feel free to message us and let us know that so we can reach out to you, because we have people backing out all the time. We need the experts. All right, there we go.
Now we'll introduce our rock star panelists today. We have, maybe I'll let each of you introduce yourselves as they're listed. So Beth, if you want to kick off.
Yes, good afternoon, everybody. I'm Elizabeth Risner from the Butler County Board of Developmental Disabilities.
And Tanya wasn't able to be here today, but we do have a new person that's not on our list. Paula, can you introduce yourself?
Absolutely. I am Paula Washek, and I'm with the Clearwater Council of Governments. I'm a benefits and support specialist. Been doing this for seven years.
Thanks, Paula. Dorinda.
Hello, I'm Dorinda Gear, and I'm a certified work incentive practitioner, as well as transitioning youth and about 40 other things. I work for Fairfield County Board of DD, and I've been doing this about 8 years.
Awesome. Jeannie.
Hi, I'm Jeanne Hall. I'm with Opportunities for Ohioans with Disabilities, and I do work incentives consulting. I've been doing this for, gosh, I think almost 9 years, about 9 years. So
All right, and Latosha, let's see. I don't know if we should make her use her voice.
Excuse my voice, everyone. My name is Latosha Ollinger, and I work with the Warren County Board of Developmental Disability Services, and I'm a work incentive coordinator. And I believe I've been doing this around 9 years. I don't keep track, sorry.
Good for you. And Christine, I'm so glad you made it. We were worried.
Hi, Christine Brown, clinical research assistant and self-advocate. I work at the OSU Nisonger Center. I'm passionate to seeing we get everybody to get educated on these options so that people do not have fear trying to go for work, because we need to cut the red tape and see that this cannot happen.
Thanks, Christine. And Nate, why don't you introduce yourself? Because I don't think you're on this screen yet either, but you are here and we're glad you're here.
Thank you. Oh boy. Good afternoon, everybody. My name is Nathan Turner. I work on DODD policy.
Yes, Nate has been off and on helpful with us, and he when he wasn't working for DODD, and now he's working for DODD, and it's great to have you here, Nate. So thanks for being here, and we'll get your name added to that.
Our
Oh,
third
already-
final poll.
Are we really gonna do? I thought we did this at the
I thought
end.
we did this at the end.
Yeah, actually, just hold off on it. We're gonna do that right at the end. We're gonna have we'll share again when we get to the questions and the poll. But we were gonna have somebody else. I'm not sure who's sharing the PowerPoint that you wonderful panelists are doing at this point, but one of you are, right? We talked about who was sharing them between Ann and I, but we didn't share, or who's sharing them between Dorinda and Jeannie and Paula and
Would you
Elizabeth.
like me to? I've got it pulled up, unless if you all made additional changes.
Oh, I think they want you to.
I win. Yay.
Yay.
Enough.
Putting the pressure on Ann here to roll with the punches.
I'm on it. Just give me 1 second to get it to the beginning. Okay.
All right. I'm going to mute myself now, because now is when I know nothing. There we go. I will read comments.
Am I the one that starts on this?
yeah, do you mind, Christine? I think we were talking about the first 3 for you.
Okay,
That's okay still? Okay.
yes. Well, thank you everyone for coming to listen to us today about the Medicaid buy-in for workers with disabilities and how to maintain Medicaid coverage if you are employed. Next slide. So what is Medicaid buy-in? Medicaid buy-in for workers with disabilities is an Ohio Medicaid program that provides health care coverage to working Ohioans with disabilities. Historically, people with disabilities were often discouraged from working because their earnings made them ineligible for Medicaid coverage. Medicaid buy-in was created to enable Ohioans with disabilities to work and keep their health care coverage. And on June 30th, 2007, House Bill 119 was signed into law, creating a Medicaid buy-in for workers with disabilities program, and enrollment began April 1st, 2008. And to qualify, currently it's 16 through 64 years who is also working full or part-time, being a US citizen or meet specific non-citizen requirements, be disabled as per the Social Security Administration. If you get SSDI or SSI, you will be eligible. If you don't get SSI or SSDI, Ohio's Division of Disability Determination will check to see if your disability qualifies. Check with your local Job and Family Services office as they will require medical documentation no more than 18 months prior to your application date.
Thank you, Christine. In addition to what Christine has shared, Be Prepared JFS may require the following verifications. Basic medical JFS form 7302, completed by a doctor to get a detailed picture of your full medical history. Social Security Report for Disability Determination, SSA form 7004. The purpose of this form is to provide a record of your earnings history, as well as an estimate of how much you have paid into the system and an estimate of benefits you may be eligible for now and in the future. A mental functional capacity assessment, GFS 7308. The purpose of this assessment is to determine if a person is moderate, mild, or not at all limited in the areas of understanding and memory. Next slide, please. JFS will require a current physical or psychological evaluation. JFS will also require a social summary, form 1111. The applicant must have a disability that meets Social Security definition of disability. For adults, Social Security says you have a disability if you have a severe physical or mental impairment or a combination of impairments. Your condition has lasted or expected to last for at least 12 months. For information, visit the link below. Next slide, please. To be eligible for MBIWD, you must have monthly countable income under $3,038 per month for the year of 2023. If countable income is over $1,823 gross per month, you will have a premium. At this time, JFS is currently not collecting those premiums. To apply, you can visit your local JFS office. You can apply online or by phone. Now I'll pass it on to Ms. Paula.
Thank you, Latosha. So there are a lot of income disregards that go into the calculation for MBIWD. Some of them listed here, and this is actually the order that they get excluded from income that is counted. The first one is an earned income tax credit or a child tax credit, infrequent or irregular income, earned income of any student children that are in the home. So if a child in the home is working, that income will not count. And there is a $20 per month general income exclusion, and that's applied to unearned income. But if there isn't any unearned income, then any portion of that $20 per month income exclusion will get excluded from earned income. Next slide. If you're working, they also exclude $65 of earned income. And then they look at any impairment-related work expenses, or IRWs, that you might have. I think someone later is going into more depth what an impairment-related work expense is and how that factors into the calculation. And then after that, income from working is actually only counted half of it. So they divide by 2, that rest remaining income from working. They also look at whether or not there's any blind work expenses. So if an individual has an impairment, vision impairment as their primary qualification for disability benefits, then those blind work expenses can be excluded. And income going into an approved PASS plan or a plan for achieving self-support can also be excluded. And then after all of these income exclusions, if income is still above that 250% of the federal poverty level, which again is $3,038 per month for this year, there's an extra like bonus $20,000 earned income disregard. It can be used monthly in any month that they're over that limit, or it can also be taken out a little bit at a time per month until that complete $20,000 is used. Next slide. And then resources. The other eligibility that they look at are resources. So for MBIWD, countable resources cannot exceed for this year $14,318. And this amount does go up a little bit every single year. And then what counts as a resource? So a resource for somebody would be anything that they have in a savings or checking account, any cash that they have on hand or in their homes. If they have any credit union accounts, if they own any real estate that they don't actually reside in, that counts towards the limits. Stocks, bonds, including savings bonds, IRAs, and 401ks from past employers that are just kind of sitting out there that are accessible to somebody, those also count as a resource. Some resources that don't count towards the limit are the home you live in. So somebody can actually own the home that they reside in. They can also use or have one car in their name. If they own more than one vehicle, then the value of the lowest vehicle is counted towards the resource limit. Term life insurance policies do not count. Past plans do not count. Irrevocable burial accounts. And then a 401k for a company that you're actively working for, that does not count as well. Next slide. And I'm going to pass it over to Nate. He's going to talk about stable accounts.
Thank you so much. Stable accounts are one of my favorite topics. They're tax-advantaged accounts for eligible people with disabilities to save and invest money without having to worry so much about the impact on their public benefits. As long as the disability has begun before the age of 26, the money that goes into the able or stable account is not counted as a resource. I think there's an exception for SSI recipients. The first $100,000 of resources in a stable account will not impact SSI eligibility. And then if it goes over $100,000, then that will impact SSI eligibility. If you open a stable account, you can put up to $17,000 per year from any source. And then for people who work, you can also deposit up to an additional $30,590 from earned income annually. So for account owners who work, always prioritize able to work contribution first, because that bucket is only available to the person who owns the account. And then for more information, you can refer to stableaccount.com.
Can I say something to follow up from Nathan's, please? And that is that for this the stable accounts, currently it is 26 or younger, but starting in 2025 or 26 is when it's getting changed to 46 or younger. I have to double check that, but that's what I remember, that it got passed in that Secure Act 2.0, that the age for a stable account is getting adjusted.
Okay, ready for me? Now we get to the fun part, how premiums are calculated. Premiums are determined through a set of calculations based on income, family size, standard deductions, and so on that actually Paula kind of talked about earlier. The calculation is you take 150% of the federal poverty level from the gross family income, and this can be done on a monthly or an annual income. I tend to do them monthly. I just think it's easier. Then you subtract impairment-related work expenses or IRWs, blind work expenses, any medical and recurring expenses. The remainder of that is what's called the net family income. Multiply that number by 10%, subtract any other family health insurance premiums, such as, someone may be paying Medicare Part B and or D premiums, or maybe they have employer, maybe a spouse has an employer health premium, those would be subtracted as well. And that is how you get the premium that a person is supposed to pay, which we'll get to more of that in a minute. Next slide, please. In 2023, an individual eligible for Medicaid buy-in for workers with disabilities with income greater than 150% of the federal poverty level, which is the 21,876 or the 1823 per month will be required to pay a monthly premium, sort of. Income includes earned and unearned income. So for example, Social Security disability benefits are unearned income, so it does count. Next slide, please. So to show you on a slide, we'll just kind of keep it easy. Gross income for this individual, $2,000. You minus the 150% of the federal poverty level, which we said is 1823, gives you 177. This individual happens to have impairment-related work expenses in the amount of $55. Subtract that, and now you have 122. Multiply that by 10%, and this individual would have a monthly premium of approximately $12.20. The federal poverty levels, please keep this in mind, they change every year. So what you're seeing or what we're referring to this year are for 2023 numbers. They would change, obviously, next year. Next slide, please. There are lots of ways to find information and helps out there. One of them is called the Disability Benefits 101, or for short, DB 101. The website is shown here. There are all types of tools and information on employment, healthcare coverage. You can determine if someone may or may not be eligible for a specific benefit. Do keep in mind when you use DB 101 that it is a general estimate of an individual's potential for in this case, MBIWD premium. It's only a tool. It doesn't mean that's exactly what the amount's going to be, and only Job and Family Services can determine eligibility and exact premium amounts. Next slide. So let's use some examples here. M is 40 years old. She has an individual options waiver, and she receives $1,000 a month in SSDI benefits. She's offered a job with gross earnings of $1,000, which makes her monthly countable income $2,000. If she does not have MBIWD or is not enrolled in MBIWD, she will incur a monthly patient liability regarding her waiver services of $152. Easy peasy. If you enroll M in MBIWD, her patient liability goes to zero. Problem solved. She will have an MBIWD premium of approximately $17. And as I said, there's an issue there. So when premiums are collected again, they are not collecting now, and we'll explain that more in a minute. One thing that's really important, and I know we kind of run into this all the time, even with JFS, when a person is enrolled in MBIWD, they are no longer held to the $2,000 resource limit. Now their resource limit is $14,318 in 2023. So that's a good thing, especially when we have people working and trying to save money. Next slide, please. So
Brenda, can I stop you just for a quick minute? Because I wouldn't want anybody to be going without understanding. A quick question about what is patient liability was asked. So let's just be clear about that.
Okay, I can be clear about that. So when an individual is enrolled in a waiver, there's numbers associated with everything, thresholds associated with everything. There's a threshold that a person can have as countable income before they incur what we call patient liability. What does that mean? That means the money the individual that receives the waiver services for has to pay directly to their provider for the services they are receiving. So for example, in this situation, M, if she was not enrolled in MBIWD, or maybe she's not even working and she can't enroll in MBIWD, she has a patient liability of $152 per month that she has to pay directly to her provider. But if she's eligible to enroll in MBIWD, that patient liability goes away.
Okay, and just to follow up with that, it says when the person does need to pay the premium, who are they mailing their payments to? When you say the provider, what does that really mean?
So when they have to pay the patient liability or the premium?
That's a good question. The question actually says premium.
Okay, so I'll go ahead and hit this now.
Okay,
All right.
sorry.
That's okay. That's okay. I'm pretty sure we have it on another slide.
Okay.
So the system, the business system that sends out bills to anyone who may have a premium for MBIWD enrollment has been broken, literally broken, for more than 4 years. Because it's broken, by law, Medicaid cannot bill anyone anything until the system is fixed. So although an individual may have a premium, they're not paying it now, and they shouldn't be asked to pay it either. And we have had situations where JFS has required someone to pay a premium for their MBIWD or potentially lose the enrollment, and that is absolutely wrong by law. When is the system going to be fixed? Nobody has a clue. That help?
Yeah, she also said the patient liability would be, where would they pay the patient liability? Is
So
the
the
other
patient liability is paid directly to the provider. So the provider there's a system that allows the provider to bill. Okay.
Thanks. Yep.
Okay. Okay, so we're back to T. T is 25 years old and has a self waiver. He receives $1,400 in child disability benefits. And hopefully you know what that is. A CDB benefit is a Social Security disability benefit that an adult child receives off of their parents' work record. And the parent must be disabled, deceased, or receiving disability benefits. Okay, T is offered a job with gross earnings of $1,400 per month, which makes his monthly income total $2,800. If he does not have MBIWD, he's not enrolled in it, he will no longer be eligible for the waiver because he's over what's called the special income level, or the SIL. If he has two options. He can develop a qualified income trust, a QIT, or what's also called a Miller Trust, deposit his income over the SIL amount only into the QIT, or he can enroll in MBIWD that alleviates the patient liability and keeps him eligible for the waiver services. Clear as mud. Next slide, please. Okay, so this is what I was referring to earlier. Monthly premiums are absolutely not collectible. And I don't think I need to repeat that.
Somebody did say, do we anticipate that when it does start working that they'll owe for back premiums?
No, absolutely not.
Okay.
By law, they cannot go back and charge for the last several years. Okay, so here's another problem. So there's all kinds of problems with Medicaid right now. On top of, we're in the middle of Medicaid unwinding, and it's just a real chaotic situation. But back in 2019, just before the pandemic, there was a revision made to the Ohio Administrative Code that changed the premium calculation, but it exceeded the authority granted by the Ohio legislator, the Ohio Revised Code, which dictates the premium is 10% of the net family income. What happened at the time was all of a sudden people started getting these notices that their premiums doubled and tripled in some cases. Again, they were not allowed to collect that premium, but that's what happened. So just before in October, before the pandemic hit, after lobbying Medicaid at many different levels, they agreed the change was not appropriate and they would change the Ohio Administrative Code. To date, they have not done yet. So if a premium notice, or if it's even just mentioned in a notice of determination, make sure that the premium is being calculated correctly. And if not, if anyone ever has an issue with that, we have an argument paper that you can use, and I've used it several times, to go back to JFS and tell them you need to rethink how you're doing it because it's wrong. Next slide, please. All right, another problem, and I've dealt with this several times too. JFA, whoops. Back one, there we go. So according to the Ohio Administrative Code, which we tend to use a lot, an individual does not or is not required to be in receipt of SSDI, Social Security Disability Insurance, or supplemental security income in order to be eligible to apply for Medicaid buy-in for workers with disabilities. Unfortunately, Medicaid is not adhering to that code as well, and they are automatically denying people that don't receive those benefits. In several cases, I've appealed, then went ahead and obtained a disability denial from Social Security, which is not needed at all, period, but I just did it to make sure we had it. The denial was based on income, not the disability. Went back to JFS and reapplied, and to date we still are getting denials. So that's not resolved yet either. Okay, next slide. Appealing an MBIWD denial. Denials can be made for several reasons. Not disabled enough, which really bothers me because we're not the VA. We don't have a percent of disability for the individuals we serve. Requested documentation is not submitted, or the countable income is over a maximum threshold. Definitely appeal if the individual meets the Social Security definition of having a specific disability. How to do that? Refer to Social Security's Blue Book, and you have to go paragraph by paragraph, match it to a medical and/or psychological evaluation. And if they match, then definitely appeal. Okay, next slide. Am I still on? Tell me when to stop.
I think I can take over. I think I had the next couple maybe.
All right, great.
But you're doing a great job. I don't know if you want to continue.
No, you go ahead, Jeannie. Thank you.
Okay. Okay, so a little bit more on the appeals. The individuals, they're going to receive a notice of action from their county job and family services office, including the date and case number. Page 2 typically is going to state the reason for the denial. All notices have an attached state hearing request form at the end. So if you're filing the appeal by mail, you'll want to fully complete, mail that appeal to the address listed on that last page of the notice of action. And if you are able to file electronically, that's going to be faster, easier, and you'll receive a confirmation via email when you do the electronic filing, the appeal. Okay, the next, there you go. Let's see. Okay, so here's some different ways you can ask for a hearing. Electronically, submit the hearing request to the Bureau of State Hearings SHARE portal. And this has the details here. You can log in using your Ohio Benefits ID and password. And then you can sign up if you don't already have an Ohio Benefits account. There's the link to sign up. You can ask for the hearing via email. And this lists the email address you can use. Use state hearing request as your subject line. Make sure to include your name and your case number, reason for your request, and then attach a copy of the form. You can also file by phone, calling the ODJFS Consumer Access Line. Their number is listed there. You can via fax, a lot of options. And there's the fax number listed on this slide, or you can choose the regular mail. Complete, sign the form, and mail it to that PO box listed for the Bureau of State Hearings. Always keep, this is true for anything related to benefits, always keep a copy of everything that you submit to any agency for your own records, and try to document like when you submitted it, mailed it. If you can get a receipt, again, this would be for anything, appeals and any records you're submitting to Social Security, JFS. Just try to get a receipt that they've received it to, like a documentation on your behalf. Okay, and then contacting your local office, but we noted it's better to send in the form rather than just calling the county JFS. And I don't know. I think someone else maybe.
You want me to chime in here, Jeannie? Hey,
yeah,
hey,
go
everybody.
ahead.
I'm gonna take us down the home stretch. So I get the easy part here. So appeals are normally held by telephone. The state hearing officer will send a notice to the individual or the representative if one is listed. The individual, if they do want to have a representative represent them, they do need to submit that in writing, and always include your case number and the full name on the letter. And we give you the email here to send the hearing information to, which is bsh@jfs.ohio.gov. If you want to write that down, that's a good one to keep in your back pocket. And if you want to switch to the next slide there, the key takeaways. So the bottom line, if you've heard nothing else today, we keep it for you at the end. So age limit is 65 for now. You must be working. Disabled individuals who are working may not be eligible for regular Medicaid due to their earnings level. Disabled individuals working not eligible for regular Medicaid receiving SSDI, but not yet eligible for Medicare. Disabled individuals working who do not receive SSI or SSDI and have a Medicaid waiver service and incur a patient liability, as we discussed in detail earlier, for those services. They must meet Social Security's definition of disabled, and they must meet the income and resource limits that we discussed on the previous slides, and may have a premium, although Dorinda did a good job of letting us know that they are not being collected at this time. All right, so I hope that helps. And then I'm going to toss it over to Christine because she has done some wonderful advocacy work in this area in regards to the age limit. So I'm excited to hear what you have to say.
Thank you. So recently, in the 2-year budget, the Ohio House and Ohio Senate have voted yes to add the 65 and older category. What this will do, but it first needs to get signed by the governor before we celebrate, is that the plan is to add the 65 and older category in by September of next year, because the thing is, they said give Medicaid a year to try to get things worked out. As if people age out beforehand, then once the new category is added, they can reapply and come back. We are going to plan to be doing some regional talks on this because it's very important. I want you all to know that I think when Lisa Combs and I and other counties worked on real live cases of people when they didn't get to work anymore, what the cost of their personal services went up like from $9,060 to $31,000 and something. We told the legislators, do you want the cost to go up like this? And they said no. So real live example budgets are powerful. And so we plan to get this going. Another thing I'm planning to work on is creating a Medicaid Buy-In Awareness Day. There's no such thing in Ohio. So we need that, but this has taken close to 8 years for me to get this done. And when I set my mind to something, I don't quit till it's done. And then I have another thing next. So we will plan to get everybody educated on this as soon as families in transition, like age 14 even if they can't enroll, they know about it before they start going for a job.
That's right.
So we are excited for this because, and thanks with the Ohio Chamber of Commerce and Steve Stivers, who was the senator who created Medicaid Buy-In when he was a state senator, but he's now the chair of the Chamber of Commerce. All those businesses are wanting workers. And again, there's no age limit for a Ohioan without a disability working. So why should there be an age limit for a person with a disability? And there was 21 other states that allowed people with disabilities to continue working. And I said, well, look at this. This is all these states that allow it. And we're an employment first state. We have rights to work until we decide to retire, not be forced.
Yeah.
So we will keep you guys updated, and we will soon have some session once the law gets changed.
Absolutely. Christine, and you're selling yourself short. The only thing I did to help Christine was help her find the stories. She did a lot of that legwork, and the county boards who shared the stories of the specifics, and some people that aren't even eligible for county board services, and this is affecting, also were really helpful. So it was a really good group, and I'm really excited that we made some progress. So are we ready for questions yet? We got plenty.
I think I saw some question in there about somebody talking about a 401k or something.
Yeah, I'll read
I
them
don't know.
out, and you guys can all jump to see who wants to answer. So yeah, Diane asked, if you withdraw from a 401k while working with interest or penalty, does that 401k count? So that was early on in the conversation. I don't know what TIAA means, but does that count? Anybody?
I would say if it's a 401k from a past employer, then yes, the 401k counts in general, because that's on the list of things that count if you're not actively working for that employer. But if it's an employer you're actively working for and you take a penalty to access that 401k, that whatever you're accessing minus the penalty would count as income in the month you receive it. And then the months after that, it would count towards the resource limit if there were any left over.
And I think I would say, as a supplementary answer to that question, this situation shows the value of able accounts for working people with disabilities, because they can function as a more flexible retirement account, especially for folks like me. I don't have access to a 401k. So my stable account partially functions as a retirement account for me, and I can withdraw from that without penalty for qualified disability.
Awesome. Thanks. Okay, I'm just going down the line. I know some of them might be somewhat related to each other, but I want to make sure we get to, so if someone is married, does this affect their income, asset limit, or premium?
Yeah.
So eligibility for MBIWD is based on the individual who's applying, but the cost, the calculation for the premium counts all household income that's countable.
Okay. How do you sign up for MBIWD with Social Security Administration? I guess it's a question mark, phone call, question mark. How do you get MBIWD?
I'll try to answer that.
Sorry,
No,
go.
no, go ahead, Nate, please.
No, I was
Everybody
gonna
jumped
say, I
in.
think
Okay.
MBIWD would be administered at the county level. 1619D would be administered by the Social Security Administration.
Yep. I'll just add that I think I answered it and typed up the answer somewhat related. Another question on here was often if someone already is in another category of Medicaid, say like SSI Medicaid or 1619B, you can just contact by phone your local JFS and ask to be, put in Medicaid buy-in. Now they might, if they don't already have proof that you're working or something, there might be other documentation you need to submit before they can do that, but often you don't have to formally like fill out a big application for Medicaid if you're already in another Medicaid category.
Just to add to what Jeanne said, that sometimes the local Job and Family Services office will also automatically enroll someone in MBIWD if they meet the qualifications.
And
When
while we're
I would add that
Go ahead.
when you submit a 7200 application, you will want to write on there that you want that category explored, just so that it doesn't get missed, because I have seen that happen.
And some of you might have seen Dwayne's comment in there about the frustration that when you do contact JFS, sometimes there's not a lot of knowledge about MBIWD there. And Jeanne certainly did answer that in the answered ones that you should be able to read. But again, it does happen. This is Christine. I mean, whether it's, JFS or your local county board, SSAs or service support administrators or whoever, there is not enough people do not know about MBIWD. We will absolutely 100% agree with you. And that has been, Christine, that's your mission, isn't it?
Yes, because what we want to do is we want to see that everyone from the transition coordinators, even people who work in the Department of Mental Health and Addiction, when they are just don't know what to do, because they don't know Medicaid buy-in even. And I will be honest, we have a plan, I do, that we need to get this whole entire the chart together of what's the path when you go through your transition coordinator in the schools, then you go through F.E.A.R, you go through counties. Who do you talk to with who? The thing we don't want is that the person and the team all work together and are on a straightforward path to applying for Medicaid buy-in, and then all of a sudden the JFS worker goes off insane. No, if you work, you're going to be ineligible for Medicaid. I don't know this thing. Then it makes the parent and the team go through panic. And then they say, well, I got told from JFS my son or daughter's going to lose it, so I'm not going to allow them to work. We need to have a better system out there, because the thing is, everyone deserves to make sure we're in a very good setting to see that people know what can be done and how to get it working. Because I'm telling you something, there's even a JFS worker in Franklin County who's worked in the field for 20 plus years. And I heard he can't know the difference between like saying you can't be on SSI and Medicare, or you can't be on SSDI and a waiver, this, that. It's like, oh, get your head on straight.
All right.
So anyways, we will be setting up more trainings and updated SSI calculator data sheets and all those others.
Yep. Nate, did you have something you wanted to add in?
I don't know that I had something I wanted to add in about that, because I think Christy did a great job explaining it. But I had a question as a result of that discussion, and I know I'm a panelist, but it just goes to show we're all learning. Do any of the others have any insight into how any additional insight into how the resources are calculated? I know with the Social Security Administration, the resource determination is very specific as to midnight on the first of the month, and they have legal authority to contact financial institutions and get banking records. I don't know if any of the other panelists have any insight into how JFS would determine the amount of resources that somebody has.
To my knowledge, they follow the same rules as the Social Security Administration in the Medicaid for the rules for resource counting. They would probably be also the first of the month because it says it follows the SSI rules for counting resources. So it would be the same name.
Gotcha. Thank you.
First moment of the month.
All right. I'm going to keep working through. We got a couple more questions still open. So is there a scenario when someone would not want to use Medicaid buy-in? We have quite a few upvotes on that question.
I would say if they're eligible for 1619B and don't have a ton of excess resources and can still meet that resource limit, then 1619B would not have a premium associated with it.
Anybody, any other panelists want to jump in?
I agree with, yeah, exactly what Nate said is what I would say. That's the one scenario where sometimes it just makes more sense. If you're within the income limit for 1619B Medicaid, you know, if it's going to be high enough where you'd owe a premium potentially for Medicaid buy-in, it probably, and like you said, the resources aren't going to be an issue. $2,000 isn't a problem, or if you have a stable account that you can put it into, then yeah, technically you, it probably wouldn't be an advantage to do MBIWD in that specific situation. But a lot of situations, it's going to be the best option for people.
Great, thanks. This is going back to Dorinda. They want to know why the premium was taken away. Everybody's always obsessed with this topic, Dorinda.
It wasn't taken away. It had nothing, and it has nothing to do with the pandemic. Nothing.
Okay.
It's the fact that the actual business system, that's the hardware, you know, the software that processes, that calculates and processes and sends that bill to John Doe, is broken. So that's why you don't get a premium notice.
All right. Okay. So did we answer this one from Leah already? How do we request for disability determination services to decide whether or not an individual is disabled? Assuming they've never applied for Social Security benefits.
Yeah, so disability determination services is a division of opportunities for Ohioans with disabilities. And their specific role is to make disability determinations for those who are applying for disability benefits through Social Security. So they don't just make a disability determination without someone applying for SSDI or SSI.
Okay. And then Patrick's, I don't know if it's he's kind of asking a question, but between benefits and earned income, an eligible person can save up to $30,950 total from the two incomes per year. Yes, question mark. And Nate is giving a big nod. He seems to feel good about that one.
Yes, that is correct. I mean, the 17,000 anybody can contribute to, including the account owner. The 13,590 is specific to the account owner, and that's up to 13,590 because you can contribute all of your income up to 13,590, which is the poverty line for one person last year, I think.
Yeah, I think that was last year's number. I don't know.
Yeah, it updates every year with the previous year's number.
You're talking about stable, right?
Yes.
Okay, and just remember there's a cap. So
Yeah.
for people that receive SSI benefits, the cap is 100,000. For those who don't receive benefits or receive SSDI, it's 500 and some thousand.
Yeah,
Medicaid,
so when
Medicaid as well.
No, I was just saying, if somebody has SSI and they're getting around the, the 90,000 mark, you would just use the money in the stable account to pay bills. Use the bill pay function and just have your stable account directly pay those bills and then just replenish excess.
This reminds me that we probably want to do another stable, presentation. We did one in, I think, 2022, like a year ago. We had somebody come, and Nate was going to be a guest on that one, but he had an emergency come up, and so he didn't get to give his stuff. So we probably will be due to kind of maybe do another one every year. Some of that stuff updates, so it's good to have new ones. But there is one on the Employment First website that we did, the training that we did back then. Who was that with, Nate? It was with
Logan Phillips, maybe.
Yeah, I think it was Logan. Yeah, and he has a whole different style of doing it. So it's always good to hear from different people at different times.
I'm just gonna say the max one can put in the stable account, I believe, is $523,000 per year.
Okay. So Portia said, is it true that one can only add a maximum of 17,000 in 1 year? You just said that, didn't you, Nate?
Yeah, it's 17,000 in 1 year from third-party sources, plus up to an additional 13,590 if the person is working, and the lifetime maximum is at 523,000.
But if you work in a non-social security job and pay like into OPERS, you don't qualify for that part then.
No, you still do.
Oh.
It's just about, you cannot, in order to have that additional 13,590, you can't contribute to a retirement plan, which is an important distinction.
All
Hey,
right.
Lisa, I saw on there where you said there's a Fairfield County family that needs help.
Mm-hmm.
So I wrote their email down. I'll get a hold of them. I don't know if they're on the session.
Yeah, I think
or not.
they are. And I told them one of the panelists would reach out to them and help them either find a local help or walk them through a few things. So
Yeah.
will do. That was Terry, I think. Star wanted to share a resource, and Star, I don't know. Oh, she just wanted to talk to the panel. Okay, I was just going to let you talk, Star. You can share the resource. She did in the chat box a while ago about an upcoming training. But she's going to talk to the panel instead. So I'll talking is permitted. I never did that before. You sure you don't want to talk, Star? It's really exciting to talk. She's like, no, just the panel. Okay.
Over.
Oh, wait a minute. I just saw. Okay, wait. Star, go ahead.
Hi, good afternoon, everyone. My name's Star Dobush from Ocala. Thank you for letting me speak. No, I just wanted to say, if you're looking for more information on disability determination, I was able to meet with some SSI local crew, and they gave some nice videos, tops, I think 10 minutes long. I've been lucky enough to hang out with a few people on this panel call, so and also just maybe want to connect for a future idea with you all. So
Absolutely.
Thanks.
Happy to meet with you, Star. Star was also handling, I wanted to give her a shout out anyways, because she was like helping people in the chat box get their questions into the Q&A. So I appreciate that. And no worries. We are a very collaborative group here. We like to get whatever we can answered. So all right. So there is one more question regarding stable. Boy, I'm telling you, everybody wants to know about stable, don't they? Their website mentions a monthly fee for maintaining the account. Can you clarify anything about that, Nate?
So I believe it is a $27 annual fee that they do charge to the accounts for maintaining the accounts. I always encourage everybody to have a little bit in BankSafe, even, well, the vast majority of people actually use BankSafe, but even if you don't, I would have a little bit in there just to cover the $27 annual fee. It's actually split into four increments of $675, I believe. for people in Ohio.
Yeah. And yeah, my son has a stable account and I help a few other people with their stable accounts, and definitely the fee is there, but it's very nominal considering the services that they offer. And obviously they even are able to do some investing if people choose to do that with their money. So it's definitely not, you know, I don't think it's a reason to not look into stable. If you have enough money that you're worried about having a stable account, you should probably be able to afford the $27. So there's the able accounts in many states, right, Nate? And I mean, like ours, Ohio's is one of the more people from other states come and invest in ours in Ohio.
We were the first state that
Okay.
created it.
Yeah.
I thought of this question because I think people should know. And any of the other benefit consultants could chip in if you want to. Some people wonder that the taxes you get in return every year, does that count? And the answer is no, because that's stuff you get in return from your taxes. Because some people will ask me, like, hey, I get my tax return every year. Am I supposed to report this to Social Security? And I say, no, it doesn't count. Because they said, well, it's earned income. I'm getting it given to me. No. Do you want any benefit consultants want to follow up on that kind of answer? Because I know that's something some people ask me.
I'll
I
chime
think-
in
I
and
think-
add, oh, sorry,
I-
Dorinda, go ahead.
No, you-
I think that the reason it's not counted is because it's counted during your income. They count gross income during the year that you earn it. And so it was already counted that year. So then the tax return you're getting is essentially not counted twice then the following year. So that's why it's disregarded. I will add though, because I help a lot of people with Social Security, SSI applications and just long-term issues, that sometimes Social Security, if they see a large chunk of money sitting in your bank account, they don't know that it came from a tax return. So you might need to submit proof to them and to Medicaid that that's where it came from. So they just need like proof that it came from your tax return. So a copy of the tax return, maybe a copy of when it was deposited, so that they know that's where the money came from.
And Paula, do you have a certain amount of time to either spend that or put it in your stable account or whatever you might be doing when you do get a large tax return?
There is a time frame. I want to say it doesn't count for a whole year.
Maybe
That
it's 9
tax
months.
refund. I know back payments don't count for 9 months. I know the stimulus funds didn't count for a whole year when those were issued.
Okay.
I want to say the tax refunds are the same, but also the easy answer is put it in a stable account and don't worry about it.
Yeah, I'm always shocked. I mean, you get nervous when anybody starts asking for, they're like, uh-oh, like you moved money. What did you do? And every time, as long as I show them that it got put in stable, they're like, woo, okay, good. Well, everything's good.
Stable is the easy answer nowadays.
It really is. It really is. All right. Well, I don't know if we have any other questions. I know a lot of you guys did ask again all you have to do. The best way to find our recordings and the PowerPoints from the past are to go into your Google Drive, your Google search engine, and put employment first and fear factor, and it will take you directly to the page where that is. I also put it in the chat box up a little bit farther, and I'll try to copy it down there again, but it is on the end. There it is. I'm going to copy that one more time and put it at the bottom here, so you guys can see. But our past sessions are on there with recordings and PowerPoints. They also are in the OACB Member Connect, but I can't guarantee it's as easy to find because this is like just a web page that has the links. And then the one from today will be posted. It takes us a little while to get it on the Employment First website, but it will be posted in the next couple of weeks. So we just always want to make sure that our PowerPoint is that they stuck with the same topics and that they don't want to add anything or change anything to it. And Star, yes, if you want to stay on for a couple minutes. I just don't know how to, well, yeah, I can still unmute you. This webinar is crazy. So anyways, all right.
I want
Anyhow,
to throw in a resource about able to
Yep.
work from the Able National Resource Center, since that did
Yep.
come up.
you going to put it in the chat box?
Yes, give me a
Okay,
second.
perfect. If you need me to do it, let me know, Nate, but
Okay, I put it in there, but it might have just gone to you.
oh, you're right. I'll copy it and put it for everybody. There you go. All right, this is for, tell us a little bit about that resource. We got a couple minutes left.
The Able National Resource Center is a national nonprofit. They're based with the National Disability Institute, and they focus on providing information and resources for all of the able accounts across the country. And they have, if anybody's ever curious about whether a certain able program is right for you and your specific situation, you can go on their comparison tools and look at what all of the different able programs have to offer. But they always encourage people to investigate the state in which they reside because of tax benefits.
Yep. Awesome. Oh yeah, we do have to find, we have a final poll before we hit it. And can you share that our last visual, and I'll put out the polls. There we go. All right, so what's next? And we don't even have stable listed on here. So you guys are going to probably put that in the chat box since everybody
Or put under other.
there you go. Yeah. Let me go back. Let's do a quick last launch of the poll. And there you go. Is there anything, what's next? What would you like more support and training on? We've got past plans, benefits analysis, ticket to work, DB 101, closer look at work incentives, income and benefits outside of SSI and SSDI, and other, and put ideas in the chat box. So Courtney Heineman is here. It's good to have you, Courtney. She says stable accounts too. So there we go. All right. All right, got some 60 works. Dana says, how about work stress as the next topic? I agree, Dana. Everybody should take some deep breaths because that was a lot of information that some of us don't really take in very easily. And we should take some deep breaths and understand that it's okay to not be an expert on everything. You just need to know who to call. So on that note, we will go ahead. I'm going to actually, Nate just shared another one that's just coming to me, Nate. I'm going to put it out to everybody.
I'm an ambassador with the Able National Resource Center, and that just kind of talks more about my journey and story with Ohio Stable and how it supported me to full-time work.
All right,
And considering all of the conversation about stable accounts, I mean, maybe, that's a clear indication for me to revisit my slides and kind of come on for the next one and do it. Who knows? I mean, we have decisions to make and everything, but I do have my slide deck.
Yeah. So so for the poll, it's kind of a little bit all over the place. We've obviously got some people interested in stable from there, but we also people interested in benefits analysis and education, which I think we talked about last year, maybe trying to do income and benefits outside of SSI and SSDI. Those were the two big winners on those. And Portia asked in the chat box if Tanya started her own business. And yes, she did for benefits analysis. And that is called Chiles Creations, I believe. I don't know if anybody has her email that we could put in the chat box. I know she's not here today, but she normally is on our panelist group. So you can certainly reach out to her personally. Okay, I'm going to close that. And let's see.
We just have a last call for questions. Make sure that everybody got a chance to ask the questions that you have. I think our Q&A is now answered, but just a last call.
Oh yeah, Elizabeth put in the email in there for, that's to hosted panelists. Let me do another copy. We're all messing up on we're going to paste that in there. So everybody, there's Tanya's email for everybody. And for credits and trainings for today, you do not need to do anything right now. You should get an email in the next 2 days that you were checked in for our account and to claim your CPDUs in OACB Member Connect. If you don't get the email, it probably ends up in your spam. You can just check into OACB Member Connect, my events. Probably I would wait, hopefully by Friday, I'll let them know to check everybody in today. But if not, it'll be right after the 4th holiday. It'll be available for that. So, all right. That's it, everybody. If you want to hop off, we were really thankful for you're here. Look for another announcement for another Fear Factor. And it looks like we've got everything else. And Star, if you want to hang on, I will unmute you again and you can chat with us real quick.
Thank you to all our panelists for sharing your knowledge and your wisdom on this topic. Very
That
insightful.
is for sure. Thank you. Thank you. Panelists, if anybody can stay on and chat with Star for a minute, that would be great.
Might want to stop the recording.
Oh, yes, I will do that. Thank you. Thank you.
Stop sharing too, huh?
Stop recording.